Holy Cross Health Community Health and Wellbeing Department presents the psychological effects of COVID-19 and vaccines in general. This is our series, episode number 3 of our talk shows on COVID vaccine hesitancy. And today we want to bring to our audience a wonderful speaker by the name of Dr. Allan Ribbler. Correct?
Correct. Thank you.
Correct. Welcome aboard. I know that that hesitancy in vaccines has started previously, so why don't you give us a rundown on that?
Well, we can trace vaccine hesitancy back about 20 years. Scientists who published data linking the MMR vaccine, measles, mumps, and rubella, to autism. After that, parents stopped getting their kids vaccinated at the same rates that they had before. As vaccination rates went down, the rates of measles and mumps went up.
And what period is that?
He published in 1998. Since then, he was debunked. He lost his medical license in England. The studies, which were published in the major medical journal Lancet, were withdrawn. The data was falsified, but it set the stage for people to question the safety of vaccines. And certainly among pediatricians, they've been dealing with that ever since. With COVID coming along and this gigantic push to get people vaccinated, the hesitancy, certainly among certain groups, has been quite obvious.
Yes, mushroomed actually. Correct.
Among certain groups, but there's been a lot of research looking at what drives this. Certain cultures who tend to perceive uncertainty in a certain way. So when you don't know a lot about something like a vaccine, if the information hasn't gotten out, if people are uncertain about the safety or the efficacy of a drug, some cultures will avoid and say, no, I'm not going to do it. I don't have a level of certainty that makes me comfortable with that. There are other cultures where they don't deal with uncertainty, and it's not just vaccines, but other kinds of medical issues. If they don't have a high level of certainty, they're not necessarily going to engage avoidance. They may line up and take it anyway because they trust their doctors or other reasons.
Well, that was a different time for sure.
Yeah, but in 2020, hesitancy was very high, mostly over side effect concerns. As time went on, we've seen hesitancy rates go down as people became more familiar, and maybe they know more people who have had the vaccine and didn't have side effects. The side effects we know are pretty minimal for the vast majority of people who take the vaccines.
And I think the fact that as they were approaching 1 million people dying, I think that also pushed people into doing it because, my chances of staying alive are better with it, hopefully. And then there are other people that don't believe that.
There are still people who don't believe that, believe it or not.
Yes, I believe it. Our shows have pushback sometimes.
Yeah. There are still physicians I know at our hospital that aren't vaccinated.
Wow. I don't understand the logic behind that.
There's a belief among a lot of people that getting the virus is better protection against the virus. Getting it and surviving is better protection than the vaccine. Now, some of this is driven by people who believe misinformation in the community. We know that misinformation increases vaccine hesitancy. And there are people who don't trust the government, believe it or not. And we see this across different cultures. It's not just here in the United States. We can see it in other cultures where people don't believe the government or they don't get credible information from the government. But as time has gone on here, vaccine confidence has gone up, certainly as far as COVID goes. What's really interesting is, my generation, a vaccine came out and we ran and got it. I mean, certainly for polio.
Polio. I remember polio. I remember standing in the lines, long lines for that. Actually, I was in the service, so you don't have a choice.
I remember taking the sugar cubes with my boosters, because the polio was, I think, 3 doses over time.
Why do you think it would be not included in the regular vaccination regimen that children have to get into school? Why was that never included in that?
Well, it was. It ended in about 1979 because there were no cases of polio. Polio was believed to have been eradicated in this country. So the requirement for polio vaccinations went away. Of course, it costs money to keep vaccinating people, and so
if there's no real need for it.
If there's no need for it, sure. But we're certainly seeing cases of measles on the rise. There are a lot of parents that, and parents have the option today of not sending their kids to public school. They can homeschool them so they can avoid the vaccine mandates if they want to do that.
And what about like people like myself that have been vaccinated 3 times or other? I'm getting a little tired of it. Of all the stuff on TV and this and that and pushbacks and all that. Do you believe that we will most likely have yearly vaccinations for it, like the flu?
Well, that's what I'm hearing. It's outside of, my area of expertise. But I think you're right. I think
we have a lot of fatigue.
Are fatigued with COVID. So on the one hand, thankfully, people who are getting COVID today are much less likely to get very sick and die from it, even though I think the number is that there are still several hundred people a day dying from COVID.
And then you have the different variants that come along, and some are weaker than others.
Yes, but if we get sick today from COVID, the chances of ending up in the hospital...
Well, if you've been vaccinated.
If you've been vaccinated, by and large, this is now a pandemic of the unvaccinated.
Correct. Absolutely.
But I remember back in the beginning, there was nothing to do for the patients ending up in the hospital. We tried to keep them alive long enough for their bodies to overcome the virus, or they died. There was no other treatment.
Yeah, the intubation. Oh my God, how horrible!
It was scary. Now we're seeing it with HPV vaccine. That young people who are really being urged to get vaccinated against the human papillomavirus that's spread sexually. Teenagers are supposed to go get it, but again, there's something out there that says vaccines are dangerous, and I think the new technology has played into that too. People know that it used to take years and years to develop a vaccine, and so how is it that we can get a vaccine in 6 months or a year? And people don't trust the science. Some people don't trust the science. I trust it. I read it was kind of a biographical novel about the scientists who developed this technology, which really has saved millions of lives by getting a vaccine into the public as quickly as they did. So now we can let our guard down and go live our lives, and if we do get exposed to the virus, most people are getting mild symptoms.
Mild symptoms. What do you think would be an effective way of hospitals and governments to publicize getting over the fact of hesitancy? What can we do to encourage people?
I think a big part of it is getting accurate, valid information to the public, getting them to understand, first of all, the difference between this technology and old technologies for developing vaccines. I think that's really important.
I think they have to go beyond the CDC.gov/COVID, because people just aren't being driven to read that. How can we get the public information out in a way that they will grab it and listen to it, in your opinion?
I think it needs to be done through sources that people trust.
Like EagleRadio.pro.
That might be one.
I have 3,000 followers.
But, if you look at certain communities, who do they trust? They trust their churches or synagogues or the mosque. So if their spiritual leaders are able to bring this information to their congregations, primary care doctors are typically people that people trust. For me, myself, I was going back and forth about the fourth shot. So I asked my doctor, and he said, well, I talked to one of the infectious disease guys who told him, if you're not immune compromised, you don't need the fourth shot. But then I talked myself to our leading infectious disease person who told me, no, there's no reason not to get the fourth shot. So I've gotten the fourth shot. I also got COVID, by the way. Unfortunately, I had already had 3 shots, and I had mild symptoms, recovered pretty quickly. But even with that, even getting mild symptoms, we're seeing more cases now of long COVID and understanding some of the long-term effects of this virus on heart health, neurologic disease, and other things that even if you don't get very sick.
So this is the after effects.
Symptoms can last a long time, and we don't know very much about that yet. So the best thing is to get vaccinated, play it safe, don't get the virus.
Exactly, my point. What do you think the future is as far as more vaccine developments? Like every time there's a variant, they have to change that formula, correct?
Well, today, they've been doing that for the flu vaccine every year.
Right, every year.
For a while.
But that's a year behind.
But with the mRNA technology, they can do it very quickly. They can even apply the genetics behind that to new diseases very quickly, whereas they don't have to do those years of research with live viruses in order to discover how best to deliver it in the form of a vaccine. It's complicated technology. It's way above my head. One of the women, Dr. Doudna, won a Nobel Prize in chemistry. I'd get lost if I tried to have a conversation with somebody that bright.
Well, hopefully that will also be the key for HIV.
Well, we would hope. The problem with HIV now is that most people regard it as a chronic disease. They take their medication, they keep their the levels low or undetectable. They have drugs that will limit the risk of transmitting the disease in this country. Other countries that don't have the kinds of medical system that the U.S. has, they're still really struggling with HIV, and a vaccine in those places would be life-saving.
Was able to get through Congress.
Listen, there are a lot of bad bugs out there. Viruses mutate very quickly. They're really clever. That's how they survive. So,
and now we have monkeypox. Just when we thought we were over COVID fatigue.
Yeah. Fortunately, monkeypox is not the same scourge that COVID has been.
Hopefully. I don't know. We're at the doorstep of it. We'll see. Do you think that minority communities are affected more by COVID?
Minority communities are affected more by everything. Heart disease, diabetes, obesity, malnutrition.
Is that because of access?
Part of it's access, part of it's education, part of it's culture, the kinds of foods that people are drawn to that are maybe unhealthy, lack of exercise, education. And I won't say necessarily minority communities, but poor communities may not have the up-to-date textbooks in a school. They may not have the technology in the school that wealthier communities have. If a child is worried about how hungry they are, they're not paying as close attention in the classroom as somebody with a full belly. So there are a lot of things that contribute to the differences in health outcomes for minorities or low income versus middle class or upper income communities.
So what do you think the future is for COVID?
I'm asked to pull out my crystal ball all the
Sure.
time. And the only thing I can say for sure is that we're going to live till we die, which isn't important.
I think we will not see the end of it. It'll just keep mutating.
Yeah,
And it'll be like the influenza. We'll just probably get a booster every year.
It's found a wonderful host in human beings.
Sure has. Hey, I'm good for something. There you go. Well, thank you for dropping by EagleRadio.pro. Dr. Ribbler, we really appreciate your insight on hesitancy. Thank you very much.
Well, thank you.